COVID-19 pandemic exposes our nation state to a certain global phenomenon that we hardly have control over. It also exposes our own weakness, especially when it comes to a development paradigm. What is it that we want to do as a nation? Probably except the First Republic, this nation has lived largely on rhetoric, largely on ill thought through policies, largely on policy mediocrity, and largely on intellectual laziness. Unfortunately, COVID-19 is exposing us. Do we really have our development priorities as a nation? What is it we are able to manufacture? Face masks have to be imported. As simple as that. And therefore, we don't have sufficient face masks for our health workers, for security workers, and for the public. This is something that can be ramped up if we had a manufacturing sector, a textile manufacturing sector worth its name. We ramp this up. But do we? We have become so import dependent. The other critical thing, ventilators. Somebody jokingly said we have more ministers than number of ventilators across the whole health sector. The fact that somebody can even link these two means we have very inadequate number of ventilators in our health sector. We have schools of engineering. We have schools, if you go to University of Ghana, they do medical engineering. We have the capability and the facilities. But have we averted our minds to these things? No, we are more interested in procuring from outside because of the windfalls from procurement. Unfortunately, I'm talking about Ghana as a nation state. So as a collective, do we have our priorities? Because we don't have our priorities right, we end up in situations where our president, who embodies the nation, the persona of the nation state, makes a statement of all frontline workers, and we are struggling to define frontline workers, frontline health workers. We are struggling. Because of this, if you take, for example, the water, the free water supply for what percentage of population is served by Ghana Water? A small percentage. Look, the bulk of the country in terms of landmass is served by inadequately by community water and sanitation agency through boreholes and other systems. These are not metered. If you take Accra, Kumasi, where the majority of people live, the not posh areas, I don't want to say the slums, the not posh areas, a lot of them depend on boreholes and tanker services. And yet, we make blanket statements. Water in the affected areas should go for free. Do we even distill the idea to know where that water is coming from? And I'm very, very, very worried about this seemingly good policy that receive public uninformed public applause, and yet impacts negatively on the nation state. You take electricity. Those on lifeline, 0 to 50 kilowatt hours, should go for free. Who are the real beneficiaries in Accra of the lifeline? The real beneficiaries of a lifeline in Accra are not the poor. Absolutely not. And this is something that the Ministry of Energy, or the former Minister of Power, had been battling with. We have identified the fact that the poor are not necessarily those on lifeline. In Accra, no. Because the poor generally live in compound houses. We've been unable to meter individual rooms in compound houses. If you have a compound house in Mamobi with 10, 12, 15 tenants, assuming each individual even consumes the 50 or 40, 10 rooms, we're already around 400.